All right, and we are live. Hello, everyone. I'm Elise Salisbury, Deputy Director at Sister Reach, and thanks for joining us tonight for the State of LGBT Health and Wellness Conversation. It is hosted by the only reproductive justice organization in Tennessee, again, Sister Reach, and we're hosting this conversation as a celebration, closing out Pride Month, and on behalf of Sister Reach LGBT Plus program called Boy Talk. Boy Talk is a group comprised of masculine of center women, gender nonconforming people, and transgender men. It is a safe space where we discuss topics around reproductive and sexual health, healthy relationships, and other topics that affect the masculine of center community. Tonight, we'll discuss the state of LGBT's health and wellness, where we are, and how we can make it better. Our panel tonight, on our panel tonight, we have four people who work in various fields around health and wellness who will bring their knowledge and expertise to the conversation. I'll tell you who they are and where they're from and allow them the opportunity to give a brief introduction of themselves. So on tonight, we have with us, welcome Deshawn Usher, founder and executive director of Mobilizing Our Brothers Initiative and programs officer of Communities of Color at GLAD. We have Latasha D. Mays, founder, president, and CEO of New Voices of Reproductive Justice, Pittsburgh. We have our very own Cherie Scott, CEO and founder of Sister Reach, and the one and only Dr. Emeka Hankton of UNH Counseling Services. So if you all will, in that order, tell us a little bit about who you are and the organization that you serve.
Yes. Right. So good evening, everyone. My name's Deshawn Usher. I am the founder and executive director of Mobilizing Our Brothers Initiative, so MOBI. And MOBI essentially specializes in doing social connectivity events for gay and queer people of color to see their holistic self while promoting community wellness and personal development. And another hat is serving as the program officer communities of color at GLAD. And GLAD is the world's largest LGBTQ media advocacy organization that rewrites the script for LGBTQ acceptance.
Awesome, thank you.
Good evening, everyone. Latasha D. May, she, her, hers pronoun. Just really overjoyed to be in this space tonight. Sister Reach is a sister organization to New Voices for Reproductive Justice, which was founded in Pittsburgh, but also serves Pennsylvania and Ohio. We have offices in Philadelphia and Cleveland. Philly is where I'm from. It's where I live now. I lived in Pittsburgh for 20 years. And New Voices is celebrating 16 years of organizing Black women, femmes, girls, and folks for reproductive justice. Our key policy issues are Black maternal health, abortion access, and gender-based violence. New Voices has been deeply committed to LGBTQ health and well-being since our founding. We are unapologetically Black, unapologetically feminist, and unapologetically queer. And I'm just really happy to be in this conversation, and happy Pride Month. It was a difficult Pride this year, y'all. I'm like, it just came and went. So I can't think of a better way to end Pride Month this year. So thank you for having me.
Awesome, thank you.
Hey there, everyone. Cherie Scott here, CEO and founder of Sister Reach. And I'm very excited to participate as a panelist for this conversation. A little bit about Sister Reach. As Elise stated, we are currently the only reproductive justice organization in Tennessee. We are also working regionally in Alabama, Mississippi, Kentucky, and Arkansas. And we work from a four-pronged strategy of reproductive and sexual health education, policy and advocacy work, culture change work. So for us, that includes research, that includes faith-based organizing, and arts and culture as well, and then harm reduction, which includes free HIV testing, housing, and other practical support assistance, including practical support for abortion care. So we're excited to be on the call and to share with you this evening.
Awesome, thank you.
Hello, Yumika Hankton. I'm the director of UNH Counseling Services, and I provide services to individuals in the state of Tennessee and Louisiana. I'm a native of New Orleans, and I'm incredibly excited to be on this panel with all of you. You are powerhouses, and I'm looking forward to our discussion this evening. The services that I primarily offer include individual, couples, group, and a variety of workshops and trainings. And listen, I'm fortunate to be able to serve a population that I'm passionate to work with, and that's the LGBTQ plus community. Although that's not the only population I serve, I take a lot of pride in being able to say that my agency primarily works with women and individuals of color within the LGBTQ plus community.
Awesome, thank you. Thank you so much for those great introductions of yourselves and your organization. We definitely appreciate, again, your presence on this panel. Thank you so much for participating. And so we'll jump right in, not to prolong the time, we'll jump right in. I'm excited about this conversation. And thank you all again for joining us. Those who are on Facebook Live on Sister Reach page viewing this conversation, we definitely appreciate your time. So first question to the panel. We know that the LGBT community is often, even in a progressive moment today, an overlooked demographic of people, and that health disparities are still great. This is why we're having this conversation tonight, right? And so based on your experience with LGBT plus people, what are some of the health disparities you've observed within your communities? We can go in the same order if you'd like.
Okay, well, I'll just go ahead and jump in. Some of the disparities that we've been seeing is a medical community that's not fully prepared or committed to providing unbiased, culturally appropriate care. As you stated, our Boy Talk program services masculine of center or masculine presenting women, but it also services trans men. And so those demographics are just really not centered as part of the spectrum among birthing people, whether they identify as mother or parent. Also, some of our MOC or trans male folk just really don't trust the medical community, or in some cases don't believe that they will require, and in some cases, our medical communities don't necessarily believe that they require reproductive health care. Because there's just an assumption that, if you're a lesbian, if you're bisexual, if you're masculine presenting, if you're a trans male, that you may or may not be having sex with a man, or can become pregnant through having sex with a man. So that's just a very neglected population. And so, we've worked really hard to try to center this population very specifically and intentionally and unapologetically, because somebody has to do that work. And Black women, once again, here we go, right? So I'll stop there.
I'll jump in too and say that, in reproductive justice, our work is intersectional. So we're fighting for healthcare access. We're fighting for the Affordable Care Act while we serve all types of Black people. Some of the things we've seen over the last 16 years is definitely access and information to sexual and reproductive health care, whether it's your regular visit to an OBGYN, or whether it's a need for abortion care or contraceptive care. The access is limited. Young people, what are we teaching in schools, especially for our LGBT plus youth? In Pennsylvania, you're not required to teach comprehensive sex education. And from our work that Sister Reach and New Voices does with In Our Own Voice, we have polling showing that parents support holistic, comprehensive sex education. And so New Voices our youth project is working in Pennsylvania to pass a bill that would make comprehensive sex education that includes conversations and information and affirmation for LGBT youth about their healthcare, about healthcare access is one of the things we're working on right now. The biggest thing, to Sharice's point, is this assumption that like lesbian women can't get certain STDs because of who they may be, having as sexual relations with, is really absurd and has been a disservice to the lesbian community in terms of our sexual and reproductive health. The biggest thing I think is being uninsured or underinsured in the LGBT community for a variety of reasons. For one, in Pennsylvania, I can say that Black people, 43% of Black people rely on Medicaid for their health care. So of that, we know LGBTQ folks are reliant on Medicaid for their health insurance. But we limit what's available in Medicaid, or we wait until now to pass a Medicaid expansion bill when people needed Medicaid going back to 2013 and before. Or you may work at an employer that doesn't provide health insurance to you, or it's not adequate health insurance. And so those are some of the things we're seeing, but I think above all is culturally competent, not competent, culturally sensitive care. And I think those are some of the things that we believe can make a difference for LGBT folks and who we work with here in Pennsylvania and Ohio.
Awesome.
I would say, so like when it comes to wearing the Moby hat, but when it comes to like health disparities, particularly like with Black gay men, it's always interesting because I think it's everything beyond like HIV and sexual health. Mainly because like that particular population, my particular population, has seemed to be sort of kind of, I guess, like overburdened with like the information and the testing and the initiatives that like happen, that when you are seeking like health or wellness, that like you're always seen as this number, right? And so if I show up inside of a clinic, particularly like if I disclose that like I'm a Black gay man, the first thing that they're testing me for is what? HIV. The second thing that they're testing me for is STDs. And not saying that like I may not necessarily need those services, but it's the prioritization over like, why did I show up today, right? It's like check my cholesterol, make sure like, I don't have diabetes, or just check my body, right? Versus actually being, right, instead of like just being confined to just like these different, like these two primarily boxes that like we're always in. And I know that it's not just exclusive to like Black gay men, but other like folks within like the LGBTQ community, is that oftentimes when you're showing up for these services at a lot of organizations, that's the primary thing that they like want to service you for. I think the other thing that like we don't talk a lot about is mental health and how that plays like into one, being Black people first, right? And then mixed in with the LGBTQ community. And so like you have like multiple like things that you've had to navigate throughout your life and figure out throughout your life, which I'm actually so glad that like I know that we'll talk about it like a little bit as we go on, but it's really just thinking about like, how do we actually provide like cultural, like mental health services for people like that, like is like meant to engage them, that's meant to like really support them. And I don't think that we often get a chance to do that. And then lastly, like one of the other things that I do think about is, and it's funny because it's not, it will probably never be listed as a health disparity, and it's not racism, but but it's spaces. We don't have Black queer spaces. Yes. So it's realistically thinking about like, how does that show up, right, for your community? That's why Moby realistically was formed, because it's like thinking about like these social connectivity events and people saying that like they are unaware of like these like organizations that provide services, unless it's like those organizations that we know are doing like the groundwork and like out there in the community. That's a difference. But there's other organizations that we know that are overfunded to provide these services for our community that never show up. And I'm sure y'all never see them at y'all events or your outreaches and stuff like that. We know who they are. But it's also just thinking about that, like, again, how they want to show up, right? They want to show up if it's a Kiki ball. They want to show up if it's like this other Black Prides, right? They want to show up like during these opportunities, but throughout the year, it's like we have to think about how do we hold like the people that like are receiving like this top funding for our communities accountable in the within the lack of actual having spaces to come together, to convene, to like actually support each other holistically.
Awesome. Dr. Yu?
I think what I would add is, in addition to the lack of spaces, we're also seeing the lack of adequate training for healthcare workers in caring for the LGBTQ plus community. And so you have individuals who think that just because they have a degree or they've gone to school, that they have all of the skills necessary to support our population. And one of the things that I've experienced with the individuals that I serve is that a lot of the disparities are directly related to stigma and discrimination, not just outside of our community, I want to be clear about that, but also within the community as well. So we're also seeing the pathologizing of sexuality and romantic affiliation and any gender that's outside of the binary. And just to be clear, sexuality and any gender that falls along the spectrum is not pathological. It's not a mental illness, but as a result of biases and discrimination, we're seeing high rates of depression, high rates of suicide, mood disorders, substance use, solely because of ignorance, lack of resources, social support, rejection. I mean, you can get into poverty and unemployment rates, ageism, victimization. I mean, the list can go on and on. But I think the key thing that we're missing is the education of those in position to provide care and cultural humility. I think, Deshaun, you mentioned the cultural training or cultural humility piece. That's key in working with our population.
Awesome, thank you. I know one of the things that Deshaun mentioned was that, you know, for gay males who have to walk into clinics, the initial assumption by that health provider is to test for HIV, right? And it could be, you know, in some cases, high blood pressure. It could be, you know, whatever they have shown up for. That's it's like the farthest thing, you know, from most of these providers' minds as far as why they've shown up. The irony for that is I have to, as a lesbian female, walking into my OB-GYN's office, I have to ask every year during my annual for the full spectrum of testing, which I use that language because it's inclusive of HIV testing, right? And so one of the things that I'm not asked when I approach my provider, whether it's primary care or OB-GYN, is if I desire HIV testing. So I wanted to lift that up in support of what, you know, of what you said, Deshaun, because the very opposite is true. The other thing is, I remember when I first went to see my OB-GYN, and I mentioned that we could bypass, you know, the pregnancy testing. And, you know, I was there for a procedure actually, and she did the testing anyway, which I was like, okay, maybe that's procedural. But when I asked for, I was having some issues, and I asked for, what's the procedure called? A full hysterectomy. Yeah, I asked for a full hysterectomy because of issues I was having. And she said, oh, well, you may want to have a baby. You know, and so I lift that up to say once again, right? I lift that up to say once again, we come to our providers, you know, informed ourselves about what it is we show up for. And it's as if, you know, a lot of them don't have the training to accommodate us. And so I just want to lift that up in support of what you all were saying. I appreciate those answers. One of the other things that was mentioned, I want to ask about, many LGBT people state that they are sometimes misgendered while being serviced by their healthcare professionals. This prevents many from seeking healthcare when necessary or even critical, right? It could be life-threatening, but because they don't want to be misgendered, they will not show up at their doctor's office or the emergency room. What can medical professionals do to change their approach to misgendering, ensuring that those who need care reach out for care? And we can go in the same order in which, you know, we just did in regards to the answering that question.
Yeah, well, I think it's beyond time for the medical community to expand its care capacity to be more inclusive and affirming of every patient that they may see. And that includes folks from the queer community, right? The resources are out there where folks are, doing diversity and cultural humility trainings to and for providers who are willing to be trained. And I think Dr. Yu lifted that piece up, is that there is a lack of providers, but I think even more to that point, there's a lack of providers who want that type of support, who want to create an environment of patient-centered, or, that I'm sure my medical provider friends would appreciate me saying that term, but the term that I continue to push them on is patient-led care.
Yes.
And so then I think, because we do our work in the South, right, for folks to take their personal piety out of the models of care and do no further harm, because clearly harm is being done, but to do no further harm, because it may go against your personal religious understanding. Well, you may very well be servicing someone who is atheist. And so then what happens, in that instance? And so again, for me, something that we constantly see over and over again. Once upon a time, it seemed to, be trying to push medical providers to expand, their capacity to include Spanish-speaking providers, right, from the intake to the back door, and now, I'm finding more and more as we go deeper in our work for MOC folks and trans men, that we need to continue to push even more so as far as cultural humility, cultural practices, to include folks, make space to and have that continued education to provide compassionate care to folks who identify across the queer spectrum. It's the job. You know what I mean? Like, it's the job. It's but down here in the South, we see it more and more where folks want to preference, their ability to offer care. And then we also see them being emboldened by that bias through legislation, right? So like our legislation right now, that basically protects a provider who doesn't want to provide care to trans folks with the ability to say, no, I don't want to serve you. And so then what happens to that person, right? So so what about the oath, right? So I'll definitely stop there, but those are some things that, that really piss me off, right? Because we're still talking about people who are walking around with no care in a state and part of the country that still has failed to expand Medicaid, is not interested in serving all people, makes preferences based on misguided religiosity, and causes, deep harm and mistrust among queer folks.
Ooh, that's a word, Sharice. And and I think it extends beyond the South as well. We're operating in the Rust Belt as well as the East Coast, Mid-Atlantic with our work in Philadelphia. So we're dealing with different levels of religiosity and, provide medical providers who are on the spectrum of support and affirmation for LGBT plus folks and patients. Just to bring my own personal experience into it, when I look for care, I always try to find a Black woman, period. Doctor, dentist, therapist, and that's a privileged position. We're able to provide health insurance and New Voices, but that wasn't always an option, to be picky about who you want. But to me, that's my ethos and my value. At the same time, the best care I have gotten has been outside of traditional hospital or medical systems. So community-based care is to me where I have seen and where we have seen the best opportunity to create more affirming healthcare and medical provision spaces. And so whether it's the Midwife Center, which is the place I've gone for many years in Pittsburgh, whether it's the abortion clinic who also provides care, I feel like those are the spaces that are most attuned and most interested even in serving LGBT plus folks.
Absolutely.
I think that's where the focus should be. And I've seen that in Pittsburgh, I've seen that in Philadelphia, I've seen that in Cleveland. And I think we would direct people to that kind of care before sending them to like a traditional or community-based provider, community-based clinics that have a commitment, a stated commitment to care for health care for LGBT plus folks.
Awesome.
Yeah, and I'll add that, like, I think a large degree of it is removing assumptions. And so it's thinking that just because someone presents a certain way, it also doesn't necessarily mean that the person identifies the way that like you think that they might. And so again, it's like no one knows like who I am or how I feel, and it could change. And I think that's the other thing, is that it's understanding that like that can change. I remembered doing like a site visit in the South, and like the clinic was like, they knew that they had like a large like trans population, and was like renowned for working with youth, and like really like in their trans population, and like particularly like with HIV, and engaging with them. But like I remember during the site visit that there was like this one trans participant that like they had made a joke about, as far as like, you know, today that they'll come in like this and tomorrow they'll come in like that. So sometimes it could be confusing, and it's like, well, it's not confusing, because if you know that like today they come in like this and tomorrow they come in like that, then you understand their pattern, right? And you understand like how they may or may like want to be identified like that day. So it's not necessarily confusing. It's just a matter of going the extra step and asking the person once they arrive on that day, and treating it like a new day of like, how do they want to be identified, particularly if you see that there's like consistent changes that are happening, or a pattern that's happening. Because I do think that like, again, like sometimes we do get stuck thinking that like, if you are in a process of transitioning, or if you are non-binary, that like there might be a day that we like, as if like something cannot like change, or something like can't register. I think like that's the biggest thing, is like just removing the assumptions when people walk through the door. I will also just say, so I previously I worked inside of like clinical research, and the nurses and the clinicians that I've like encountered, particularly inside of clinical research trials, have been absolutely amazing, like in the sense of that. And if you think about the retention inside of a lot of these clinical research trials, and like how is it that people have like great retention, it's always centered around the site, right? And it's always centered around the staff. Because it's weird, because it's like we act as if like this pseudo like clinic, like, and we know that we're not, right? But it's people that like walk in and know that like, I'm coming into a space like where you know my name. Like I'm coming into a space like where you actually ask like how I want to be identified, like what parts of me are okay for you to examine, what parts is it okay for you to ask, right? Which makes a difference as to how people show up and come back, where I think we don't have the same regard, particularly in traditional like medical settings, like hospitals, mainly because it's a business, right? And so they know that like, if you don't come in, that someone else is coming in their doors, right? And so it's this revolving door of people that will always need like medical attention. But then you think about the people that are like the most marginalized, that don't feel comfortable and safe inside of those spaces, and thinking about how can you actually create those particular hubs. And again, it's also thinking that like the answer isn't always like go to an LGBTQ like clinic, or go to that because like they're overwhelmed, right? In the sense that if you need like immediate care, like they've done what they've done and have been successful in what they've done. But it's also understanding that like some of these organizations are operating, particularly the ones that are LGBTQ focused, are operating at like a higher capacity, because no one else knows how to treat like other folks that identify within like the LGBTQ community, like with the dignity and respect as if like they should when they show up in other spaces. And so it's also thinking about how do we like actively work to change some of those systems. And it's really the policy, right? Because if your form, in your medical form, only says that like I can gender you as male or female,
Right.
and
Right,
if
right.
it just makes it even more like complicated, which I
Yes.
do think that like if we're talking about systems of dismantling, right, then we also need to really think about like how do we dismantle some of those systems that make it harder for people to actually access care.
Awesome.
I'll be faster with this unmuting. So I think this goes even before we receive the title of professional. I think this goes back to our medical school and professional school days. I think there should be some type of curriculum in place that's mandated, not an elective, that specifically focuses on the health and wellness of the LGBTQ plus community. Like, we can't say that attending a day training or a couple hours of continuing education, we can't pretend like that's enough.
Right.
We have to be willing to face systems of oppression. Medical professionals have to be willing to do the work to identify and acknowledge their own implicit biases. Because a lot of people don't like to do that work because it's uncomfortable.
Yes.
But doing the work that's necessary to ensure that you're not microaggressive, that you're not dismissive, that you are consulting. And this makes me think of you, Sharice, trusting Black women, making sure that you're reaching out to cultural brokers or agents within the community to make sure that the moment a person walks into your agency, that the environment is welcoming, from the documentation to the questions that you ask in the examination or therapy room, to the information listed on your website or social media platforms, to the resources that you provide at discharge. Like, you can't just stop at a single course. You have to make sure that you are well informed so that the services you provide are also well informed. And this is something that I noticed in terms of misgendering. We have to learn how to ask open-ended questions about identities and experiences and use gender neutral vocabulary. It's not that hard. We just have to be willing to do the work necessary to make sure that we are providing culturally appropriate and sensitive services. It's education.
Awesome. I want to lift up two things that I heard earlier when Deshaun mentioned queer spaces, and just then when Latasha mentioned stated commitment, right? I think, even alongside of what you mentioned, Dr. Yu, about medical school, when the professionals are going through school, being taught about these things and it not being mandatory, but what would it look like to have, hospitals to say we're affirming, or, welcome, the LGBT community plus community, making a statement of that. I think will also, which is also what's been said, it would be amazing to have hospitals or medical professionals and providers to actually make their space queer affirming. And so, yeah, that would be amazing to have our medical professionals to do that. One of the other things, though, being in the South, and I'm not sure, I was kind of surprised to hear Latasha talk about having the same issues as we have in the South. But one of the things here in the South, right, a lot of our medical providers are our preachers too, right? They're our deacons on the deacon board. They're our missionaries and evangelists who may hold these biases, right? And so they don't open up the space to have these queer affirming or inclusive spaces. They prefer to see male, female, black, white, and no in between. And so I just wanted to lift that up as another possibility, which I'm sure is a truth, right? It's a truth that a lot of our medical providers do hold those biases because of their religious, religious contacts, or their own views that they hold, that they most can't necessarily say out loud on their job, but maybe a lot of times we're not hearing the stated commitment, the blunt stated commitment in affirming or in being inclusive of LGBT folks, is because again, in the South, religion rules most things down here. And so again, I'm not sure if that's the same, if that's one of the issues you all have there, Latasha, in the North or in the I think you're on the East Coast, right? But yeah, it's definitely an issue that we have in the South.
And just to respond to that, I think it varies, but people should not be confused that, Pittsburgh is one of the most, the Pittsburgh region is not only the most whitest regions in the country, like it's one of the top whitest metropolitan regions in the nation, but it's also a very Catholic region. So then you're going to have limited access to services, not only around LGBT plus care, but also around sexual and reproductive health care and abortion access specifically. So that's the case. And there is a conservatism that that I have found in the Rust Belt. I'm from Philly, but I spent many years in Pittsburgh. And, increasingly we have expanded our work to Ohio, which is very Black. I love Ohio. But I don't think we should be, should think that religious freedoms or expressions of religious freedoms doesn't happen among medical providers in the North and in the Rust Belt and the Mid-Atlantic. And so I think, while a place like Philly would be far more progressive and have more resources, there's still such a gap in care for LGBT folks, period. There's a gap in care across the board. But culturally, the Midwest, the Rust Belt, I mean, they're politically and religiously conservative. So I don't think we should I don't think we should assume that that's not the case in the North as well. We call it up South up here.
I know that's right.
Up South.
But I think also too, to keep on that point, I think that's why it's really important for those of us who are doing work very specifically on behalf of queer folks, to get engaged and involved in religious freedom legislation and making sure that, that our voices, our understandings, our beliefs are also a part of those conversations, are also a part of the ways that we think about how we do integrated voter engagement, especially among queer folks, making sure that, our folks get to the polls and vote their values. Because, for me, religious freedom, although it's been, hijacked by the conservative white right, religious freedom means I also have the freedom to not claim a religion and that be honored. Right. I have the freedom to not claim Christianity. I've got the freedom not to, claim Catholicism. I've got that autonomy. And it's not just autonomy that is a part of my human rights, but it's part of my sacred rights, right? As an individual that is flesh and spirit and, and body, or flesh and spirit, right? So, we've got to also think about opportunities for how we think about organizing folks in our community, how we think about, bolstering these efforts to not only understand religious freedom legislation or the Religious Freedom Restoration Act, but again, how we get folks engaged around this particular piece, because while we're sleeping and not thinking about, this particular piece, this piece is steadily picking off, again, the trans piece in Tennessee is because of a religious freedom. Right, of why providers are able to say that I don't want to provide care, and understand that just also gave, access to Title X clinics to also be able to say, no, I don't want to provide care to you. But that's like federal money, right? Like you're supposed to give me care because I'm a taxpayer, because I'm an American. And you shouldn't be able to, to harm me in that way. So I definitely want to lift up, just kind of a takeaway of how we can be engaged and continue to push back, learn about the Religious Freedom Restoration Act, learn about, your rights in that way, as well as this needs to be one of the top pieces for LGBT advocacy. This absolutely has to be a piece. And I keep trying to say that in all of the spaces. So this is the platform today. And I'm going to totally say it in this platform that we absolutely got to be energized around making sure that religious freedoms for my neighbor and myself. Means that doing no harm also means doing no religious harm.
Absolutely.
Right, as well. So just wanted to add that to the conversation too.
Yeah. And I just want to say, Sharice, I do think it's important too, because when you think about overall like the engagement, I think like some people like that are not trans, right? They literally just may think, well, it's not me, right? So it has nothing to do with me. And it's thinking about like how we can use, again, like our systems, right, of us being cisgendered folks, like to be better allies to the trans community and folks, because at the end of the day, it's a slippery slope. Like, I think people need to really understand that like legislation like that could be like that like is passed right on federal and local levels. It's a slippery fucking slope, sorry to curse, but it's a slippery slope mainly because it's thinking about that you like today it might be trans, but tomorrow it might be because you're Black, right? And so let's not forget that like where some of these places and where some of this is happening, again, like in Pittsburgh, right? And so it's like I could possibly say I don't want to treat you if you show up as trans, but imagine if you're trans and Black, right? And so it's also just thinking that, like, again, it's such a slippery slope that I think people need to lend their bodies and their voices to this, because I think oftentimes like we do think that like if it doesn't necessarily affect us because it may not necessarily be like how we identify, that it still ultimately like can possibly affect us in the future.
Awesome. All right, so I want to shift the conversation a little bit to what was alluded to earlier around mental health, right? And so depression is a mental health condition that many within the LGBT community navigate, sometimes through suppression. What services do you offer LGBT folks? And for those who do not directly serve in a healthcare capacity, how can healthcare services be expanded to accommodate LGBT people who battle with depression?
Okay, we're going. Okay.
I didn't know if we were
in the
going
same
in the same order.
I just want to sit back and listen to Dr. Yu on this one right here, but go ahead, Dr. Yu.
So for my agency, again, as I stated earlier, I offer a variety of counseling services, but I think the way that we can help other agencies expand their services through like non-traditional ways. So it's not just about getting someone to come into their agency one-on-one. A lot of times it's about having these types of conversations in these spaces. It's about creating trainings and workshops where not just the employees of the agencies can come and eat of the fruit, but also community members can come in and learn as well. Creating groups at either no cost or really low cost, where individuals who may not have access to funds can still come in and get what they need. I think a lot of times when we think about counseling, we think about the traditional forms of counseling. And there's so many other ways that we can reach our communities if we're open and flexible. And it goes back to education, and I keep going back to that. I was listening to a town hall presentation the other day, and they were talking about how if you don't have EAP, then it's hard for you to have access to services. Well, while that may be true, you have a lot of providers such as myself, especially at the start of COVID, who said, okay, we're willing to offer time-limited pro bono services to a number of individuals. You do have churches who will pay for electricity and food. Why not reach out and ask, can you cover a few weeks of mental health services? So again, just thinking outside of the traditional way of doing things, and keeping group as an option. So a lot of times people want that one-on-one, but sometimes it's about getting in there in a space where you're not the only person, you're having a you understood experience, you're not alone, and you can not only support others, but you're being poured into as well, simply by being in that space. So thinking outside of the box,
I think that's awesome. I know in our faith and advocacy training, we talk a lot about the testimony service, right? The testimonial. And those, is what you were saying, those group meetings actually help. I mean, it's almost again, what we talk about in faith and advocacy training at Sister Reach, those, testimonials, or hearing somebody who's having an experience within that group setting that you may not want to say, but the shame or stigma is removed from it when you hear that somebody else is experiencing that. So yeah, that's something that I personally had never considered, the group dynamic, but that's a great option to have.
Mm-hmm.
Because we suffer in silence, we always think it's only happening to us. And I think when you can have that group experience, you realize your humanity, you realize you're not alone, and then you figure out ways as a community to heal versus just following this individualistic approach. Like, we can take this from a family systems or community approach. So I absolutely love groups. Like, I feel like I'm a group promoter.
We need to get you to help, to offer some services to our Boy Talk program. And I know that, though we don't provide mental health services at Sister Reach, we have partnered with both mental and behavioral health care providers, even if it just means offering some tips for our folks to use. And then I think, that was maybe one of the intentions of the program, to create an opportunity for brave space, especially, being down here in the South and you're so isolated. People are in community, but they're in community over one another's house. It's not like you can leave out of your door in Memphis and you can find, several places to commune and have, and have fellowship and hang out with your people all around Memphis, So it definitely, and then we also recognize that everybody wasn't out, right? And so we have our private Boy Talk page that if you're not out, you are welcome to be in that page. And we have our public Boy Talk page, so that for folks who are out and just kind of want to, know folks and build community with folks, even if it's just online. And of course, with the in-person meetings, when we were able to have them kind of pre-COVID, that was an opportunity to create a space for self-care. Definitely, Dr. Yu, more anecdotal because we're not providers, but just trying to create a place for people to just love on each other and be themselves, show up how you want, dress how you like, speak how you want. There's no respectability in it. We just want people to feel comfortable, to be themselves and to show up, and a lot of, and the majority, right, of the reproductive justice groups, like many of us are in the South, but there are some on the West Coast and in the Midwest, like Latasha's organization, and we that's a disparity in and of itself, right? That we don't even have enough of our types of organizations across the country that recognize these kind of points of entry to do intersectional organizing and creating spaces for people. So yeah, I definitely, so just know we're gonna follow up with you because you have now been voluntold, but we're gonna pay you. We're gonna pay you though.
Sharice, you're so right. Like and then for the reproductive justice organizations that exist, look at the variety of work we are called to do and that we are, feel compelled and blessed to do as well. Yes. But I was writing down a lot of notes because I do think we have to have a more intersectional approach, period, in our healthcare provision, how we do healthcare provision, and that we don't actually have to use the same structure we're using because it doesn't work. And it definitely doesn't work for Black people. And it definitely doesn't work for Black LGBT folks either. And what COVID is showing us is how do we operate in the new reality? And we have we're not thriving, but we have been able to overcome some monumental barriers to healthcare. And one of the things I want to make sure I talk about is telemedicine, because I see my therapist now through telemedicine. That just means I talk to her on Google Hangout on a secure, in a secure way. It could mean some people might be able to do it through an app. People are using, see those Microsoft commercials, how doctors are providing care. But what I said to my therapist initially, I was like, well, why couldn't we do telemedicine before? Because it's actually more accessible for me to do to be more consistent even in making sure I'm taking care of my mental health care. And I think, and then connect it back to reproductive justice and the variety of issues, but we see legislators blocking telemedicine because they don't want to see doctors provide abortion care through telemedicine. But think of all the ways that we could use telemedicine to support some of our most marginalized and underserved Black people, Black LGBT folks.
Mhm.
I want to shout out a group, an organization here in Philadelphia, Oshun Family Center. Shout out to Salima McNeil, who raised, last I saw, over $80,000 to provide free healthcare to Black and Brown folks in Philadelphia. And it was LGBT affirming. So I just want to shout her out because, again, we have to find new ways to not only provide care, but to seek care.
Mm-hmm.
The other thing is, I want to point out a bill that, we look at legislation, how cruel legislation can be, especially around trans communities and Black trans communities in particular, and how in Ohio, legislators wanted to punish providers who provided care to trans youth. And trans minors. So they didn't want providers would be penalized if they provided any kind of gender affirming care, hormones or puberty blockers. And it was so mean spirited. Like that's what we're dealing with, not just in the South, but in Ohio.
Yeah.
That's the kind of legislation that mostly white legislators, largely white Republican legislators are introducing. And those are the types of bills and policies we have to be paying attention to. Another great thing out of Ohio and the Black legislators, particularly the Black women legislators, have been talking about racism as a public health crisis. And with that, we have to declare that racism is a public health crisis along with homophobia and transphobia. And I just think it's really brilliant because it's a way for all of us to talk about the ways that race and gender oppression compound, especially for Black LGBT people. The last thing I'll say is how do we identify where there is support for Black LGBT communities? Like who are the affirming mental health providers? How do we identify them? And there are networks of mental health providers of color, therapists of color across the country. But how are we making sure that Black LGBT communities have access to that information and resources in a comprehensive way? So you can, find those types of resources no matter where you live. And I'll stop there, but you all generated such great thoughts for me. And lastly, Deshawn, you were talking about spaces.
Yes.
Any space we create helps somebody, help someone have better mental health, because the isolation that so many Black LGBT folks feel in general, and right now with COVID, how are we creating those spaces what used to be in person? How do we create those spaces online continuously, even beyond COVID? And I'll stop.
Yeah, I was just going to add just real quickly. So I know that there's, and I love like what everyone is saying, but it's also thinking like community and non-traditional spaces, right? And so thinking about how do we create like these conversations and dialogue. And so one of the things that we did with Moby, like we do like different programming things, but one of it was Moby Talks. And this year we said that we usually did it in person, which is centered around personal and professional development. But we was like, let's like, I said, I wanted to do it digitally this year so that, people can see sort of kind of like what it is that we create inside of this room. And episode 2 focused on mental health specifically. And it talked about it in different ways and like the way how you can like just see it visually, right? Like on screen, like what people like are experiencing or going through. And so when you think about like depression, when you think about suicide, when you think about like anxiety and bipolarism, and it's just thinking about like, I've never heard someone that looks like me like explain it like that, right? Or actually get on camera enough and talk about that experience, because oftentimes like we silence like those particular issues within our community. And then also like taking it a step farther of thinking about, again, like people that like specialize, particularly mental health providers, and that like specialize with LGBTQ plus folks, like what is your experience, right? And like sometimes we don't even ask like the health like providers, like what is your experience doing this, right? Providing that space and or being of that community. And so inside of the video, it was interesting to see three Black mental health professionals have a conversation about providing care and sort of kind of how their experiences growing up shaped like how they show up in the world, right? And two out of the three are queer, but it's thinking that like from a time when they were like being told like to be silent as a kid, right? And how it like, sort of kind of messed with them growing up because it affected like how they would show up in spaces and thinking about that like you can't take space, right? Or how do you like make space for other people,
right.
And how that actually plays. And so then lastly, just thinking about like building your community and building them up, right? And so thinking, we did the mental health first aid training where it's essentially like this community training to, and I would encourage everyone, like if you're able to, or if they're offering it inside of like your particular city, like to get like your groups together because, you know, like most people disguise boredom, right, as depression. And there's a difference of how I can show up for you if you tell me that like you're actually suffering depression versus like if you're actually suffering from boredom, right? Because those are two different conversations of like, oh girl, like go get some drinks versus I'm coming over to talk this out like with you. And so I do think it's like being able to actually identify like those signs and being able to show up is really important within our community. And so it's thinking about like, you know, we may not necessarily have all the answers, but it's also thinking that like as community members and as people that we want to do better like within our community and show up for our community, the more that we're able to train them up to at least identify that like this is what that is and this is what it looks like, and so then they could like be equipped with those resources that you talked about is going to be really, really important.
If I may say this, I'm so glad that you mentioned the mental health first aid. I think that's an important training, as you stated, that everyone should experience. And I think sometimes when people hear mental health first aid, they think, oh, I'm going to be put in the position to be the professional. No, this is about awareness. This is about education and resources. So you learn how to get your loved one or your friend to the resource or the necessary to get the necessary care. So it's just like CPR. You start the process, and then when the medical providers or the behavioral health providers come on scene, you kind of move away and they take over. So I really do. I'm glad that you mentioned that. That's a really, really, really great training that I think everyone should experience at some point.
Awesome. Thank you all so much. Great points. I want to double back too to what Latasha was saying about, excuse me, the bills that they're attempting to, or at least presenting in her state. And for the state of Tennessee, there's House Bill 2576, which is exactly the same as what you were talking about, where they're attempting to even criminalize doctors who are willing to assist or to render healthcare to a transgender youth. You know, it's pretty sad. I thought it was a South thing, but apparently, thank you so much for enlightening me. It's pretty sad. You know that you know our folks who are supposed to be for us, you know, in the things that they present for our well-being, as far as our legislators, you know, some of which are direct opposite, you know, of what we expect them to do, of what we elect them to do. And sometimes, you know, a lot of times, again, we're, you know, in the name of the Lord, they're doing it. And so, yeah, I just wanted to lift that up, that, you know, Tennessee has the same thing going on. And so staying on the point of depression and transgender youth, high school students who identify as lesbian, gay, and bisexuals are almost 5 times as likely to attempt suicide compared to their heterosexual peers. Do your organization serve LGBT youth in this capacity, or what resources are available to youth in your city who are wrestling with suicide?
I know we have our Sister Reach Youth Ambassador program, and I think, you know, from the beginning of the SYA program, we've always had queer youth who were a part of our program. And I think that it's important to just lift up that during like puberty, that's a real volatile time for young people, whether they identify as straight or gay, or if they don't necessarily identify as anything while they're trying to figure out their sexuality. Like that's just a very pivotal time where, you know, it's important that that spaces be created, especially by those of us who have the capacity and understanding to do so, for young people, you know, to just kind of figure it all out. One of the things, you know, and I don't think my son would mind me sharing, but I remember, you know, my son telling me as early as maybe last year, like how he was dealing with depression, right? And, you know, and my kid, you know, I mean, I don't, you know, I'm trying to provide all of the things that I'm trying to provide, right? I'm trying to give him every resource that I didn't have coming up. And still, you know, by the time you get through giving them all of the things and you try to make yourself available as you can, nothing, you know, nothing's going to change the realities of being a young person. And then the same ways, I think that, you know, we are so ageist in our thinking that young people don't go through what grown folks go through. You know what I mean? Even here recently, I just met with my therapist last week, and something that I thought was allergies, she was like, Sharice, that's anxiety. I was like, huh? She was like, all of that is not, you know, you needing Flonase. Some of that is you needing some sleep. Some of that is that you being highly stressed, you know, and our kids are watching people be murdered just like we are, right? Our kids are being shamed and blamed for their sexuality, and sometimes being punished and disciplined because of them trying to figure themselves out. You know, we may as adults feel it in more of a legislative, violent way, you know, or you just didn't get invited to the whatever the cool kids are doing that may be straight, right? But young people, you know, I mean, just the environments in which they are expected to just be at school, you know, after school programs, you know, programs are so centered on the binary, you know, and there is no space or place for young people who identify on the queer spectrum. And so I also chair a local coalition here called Memphis Teen Vision. And we've been working for about 10 years to support teen parents and as well as support teens around their reproductive and sexual health. And one of the things that was important to us, you know, was to also ensure that there were resources for queer youth and for parents whose children, you know, may be trying to come out, you know, you don't know how to handle it. All of a sudden you got disappointed because you thought that you were, you know, you had an expectation for your kid and your kid is like, I'm gay. And then all of a sudden, you know, you feel like your parenting just went out of the window, you know, and that's not the situation at all. You know, but of course, you know, it's violence against this community, right? There's hatred, you know, you know, against this community as well. But luckily we have organizations like Out Memphis, which is here, that has recently rolled out housing for young people. And then, you know, I think it's important to say that the largest population of homeless youth are gay in our state.
Absolutely.
You know, and so that's just because, you know, oh, you know, your mama is the missionary and your daddy is the elder, and they're gonna kick you out because they don't, just because the reality of your sexuality is all of a sudden a problem for them, or they, you know, or they're taking it as you know, something that they can't have in their home, a spirit of whatever in their home. So, you know, so I just kind of want to lift up that young people are already dealing with so much as it is. And sometimes sexuality is one of those things. And sometimes young people don't even know whether or not they're gay or straight, right? But there's no space for young people to figure out themselves and figure out their lives and figure out what they want. You got some young folks who believe that they are gay and they've never had a sexual experience. Just like you got some grown folks, you know, who believe that they are gay and have never had a sexual experience, right? And so, we have to be, far more inclusive and merciful, right? And compassionate with people. Even my own journey, me coming out has been stages over years, over years, over years, over years. And I also see that the page, okay, my brother,
I was gonna lift that up.
Also offers programming, to LGBT people, especially young boys, right, who are trying to figure out their sexuality in a community that has absolutely abandoned and dropped them, and turn their back. And so I appreciate that brother for making space, right, for babies to figure out their lives, right, and to be empowered. Like, hey, you gay, be gay about it. You know what I'm saying? Be happy, right? Be proud, but not to feel shame and blame. And so I'll stop there. But I just, that part pisses me off so much, because doing reproductive and sexual health education as it is, it's hard to have these conversations. And this is the thing, parents who might be watching, your kids are asking us anyway.
Absolutely.
They're asking us about abortion. They're asking us about, what it means, about queer sex, or sex between queer people, if you will.
Absolutely.
They're asking us all of the things that you won't make space for them to ask you.
Yes.
And thank God that they're asking folk who know how to answer them, right? Versus asking someone who's going to give them an answer that's going to lead them to jumping off of a bridge. It's going to lead them to slitting their wrists. It's going to lead them to swallowing pills. You know what I'm saying? Some of the depression and suicide could be reduced if we stop putting our children in a trick bag because we have some type of an issue about how they are showing up in the world. Right? My son helped bring me out the closet. Shout out to Joshua. You know what I'm saying? Right. And so, and their generation is not our generation, right? I remember when, and let me go old school Memphis on y'all. I remember when it was bad to say, looking for the chewing, right? And just talking about oral sex and when oral sex was demonized, but folks was having it. I remember when that was a thing, right? And so, every generation there is something, but we have the most fluid generation of people that I think we've had, and we gotta let them, lead and love and figure it out in ways that work for them.
Awesome.
And I would just add that I think it's so funny because I think it's about, like, I keep coming back to like these spaces, right? And so schools are spaces, and so even if like an LGBTQ, sorry, someone's calling, decline that. But even if like people are showing up inside of like these LGBTQ like affirming spaces, like how it like literally makes it normal for everyone like inside of that environment, right? So that space, like if it's inclusive enough, like it creates like a safe environment that people can be themselves, whether or not they're gay or not, right? Everyone benefits if there is an actual like inclusive space and if people have that discovery of being themselves. And so thinking about particularly like with youth, that like if they like there's this added pressure, right, to prove that you're not gay, right? And then this goes into like your bucket of the sexual and reproductive health, because people are then having babies or like because they aren't equipped with the information or trying to prove that they're not gay, right? Whether or not they are or not, and trying to figure that out because of the pressures that like we're putting on folks, like to be like to not be themselves, right? Or how they show up inside of the world and try to dictate that. I think that there's like something to be said about like visibility, because when you also think about like people that you may have never seen, right, and depending on like what part of the country that you're in, like you may not, particularly youth, it's like before, like even if I am still questioning like who I am as a child, but if I've never seen like someone that looks like me, right, inside of my life, then I'm going to automatically have like this assumption that what, I'm the only one. And how does that play into like your overall like mental like wellness and experience of like never seeing someone that looks like you, or that like may be questioning like things like you? And I think it's really thinking about like how do we amplify like people that like could be visible inside of the community that like are doing things. And so yeah, there's a bunch of like great youth programming and connections, but it's also thinking that sometimes like programs and sometimes like physical organizations can be a barrier, because it's like I then have to admit to myself, right, if I'm a young person, to build up that courage. And it's no different than older people in HIV, right? I have to build up that courage to go inside of that clinic and take that test, right? And so for young people, it's like I have to build up this courage to walk into a space, and I don't know how I'm going to be received, because up until this point, I've always felt like it was just me. And so if we do think about if we could amplify the visibility of other young queer folks, that, or in just in affirming and inclusive spaces that like actually let people be who they are, like what a world it would actually look like when people wouldn't have to suffer alone, right? Because you can have the most supportive environment, but you still have to navigate of getting home to getting into schools. And then now it's also thinking about that beyond just schools, you still have to deal with social media, right? And the pressures of like the name calling and the pressures of everything else that comes with that.
Awesome, awesome.
And Deshaun, I just wanted to add to that. There's a study about the monumental racism that young people, young Black people are dealing with. Then you compound that with homophobia and transphobia. It's just, I think that contributes also to the total mental health and well-being of Black LGBT youth. And that's something that it's not like, oh, you can go home and you're good. You're still the social media aspect of mental health, I think, is something that the youngest generation is really battling with right now. To a lesser, we deal with it too as adults, but I think it's far more harmful to young people in their most formative developmental years.
Just to acknowledge, you asked about services that we provide to our youth.
Mm-hmm.
And here's the thing. So I work with youth 17 plus, but for our younger LGBTQ plus youth, I actually work with their parents. And I think it's important to work with parents to help them understand their kids' evolving identities, how to show up for their kids, not just in private spaces, but in public spaces, and how to advocate for them in the school system. I think Deshaun mentioned just the discriminatory practices that take place in the schools and the community. We talk about, what all of the identities could mean underneath the rainbow, how to have brave conversations, or how to create safe spaces for their kids while having brave conversations about their identities. And also cultivating a safe space for parents to be able to talk about their worries and anxieties in an environment without judgment. Because a lot of times they need an opportunity to get that stuff out of their head so that they can actually show up and be present for their kids. But if they don't have a space where they can talk about the fears and the worries and the anxiety, it comes out in the presence of their kids. So I create a lot of opportunities for parents to be able to say the ugly stuff, help them to shape the ugly stuff and understand why it's ugly and the consequences, so that they can show up for their kids. Because it's a grieving process for the parents as well. They're grieving with the relationship or the identities that they thought they were going to have with their kids. And so it's important to give them that space as well. So a lot of working with the parents primarily on educating them about what's happening, what could happen, and how to really support their kids in an appropriate way.
Awesome, awesome. And I also want to conclude that question by lifting up the National Suicide Prevention Lifeline, which is available 24/7 for those who cannot reach, your provider or friend. You can call that hotline for help, and it's 1-800-273-8255. Again, it's 1-800-273-8255. And I want to also respond to what has been a comment by many of you in regards to, youth having spaces to go to, and even the parent. Dr. Yu, I think it's imperative that especially in Black and Brown communities, that parents be given that space also, because, for me personally, I was young and I knew that I was same gender loving at a very young age. My first same gender loving experience was with was in the kindergarten, right? You know, in terms of attraction, you know, I had this crush on a girl in kindergarten. And so I went several years without being able to talk about that because, you know, at this point, you know, my mom's in church, like she's a missionary, right? There's, you know, there's not much conversation that happens around that in the holiness church, except for the harmful rhetoric that folks were spewing at that time. And so, you know, my mom didn't directly say that to me, but I know when I got, you know, into my teen years to where I recognized that, okay, this is something I'm really going to have to do because it's who I am, you know, and I went to a group that was here in Memphis called Maggie, which stood for Memphis Area Gay Youth. I've looked them up, but I'm not sure if they still exist. And just to have that space where I was the only African-American female there who was masculine of center. And so, yeah, you know, I was the only person there who was masculine of center. But it was amazing just to be able to go into a space and try to figure me out. But on the contrary, I also love what Bishop said, even in the last interview last week, where she talked about going back to get your parents, right? And so bringing them into a process that, you know, like you said, it's a grieving process at first because they assume that, you know, you're going to be that child, you're going to give them several grandkids. And then, you know, as far as me, I show up with the girlfriend, right? Or I show up with a female person of interest. And yeah, it doesn't quite work out the way that the parent, you know, assumed or hoped.
But you
or
still
even
are able to give a grandchild. That's the
right. And did, you know, the other side of that is, but bringing them into that process and allowing, you know, my mother to grieve, because my dad has always been affirming, but allowing, you know, my mother that opportunity to process that. So I think that's critical, you know, in households where LGBT youth are, because that, you know, that conversation is not had a lot. And most of the time that conversation is had is between the parents sitting in the pews and the preacher sitting in the pulpit or standing in the pulpit, you know, which a lot of times in my experience has been harmful. So yeah, absolutely. I'm looking at another number that Deshaun has given us as a resource for as a transgender lifeline. That number is 1-877-565-8860, and it's available 24/7. Again, it's 1-877-565-8860, and it's available 24/7. Thank you so much, Deshaun, for providing us with that information. I definitely appreciate it. Did anyone have any outgoing notes? As I don't see. Okay, so we'll go here because I see a question that has come in the comments, right? So Dwayne Morrell of the page, also another resource here that was mentioned earlier for LGBT youth in the city of Memphis. But Dwayne asks, how do you encourage young people who are invisible in a school setting to begin establishing GSAs without further traumatizing them in that social and academic setting? And do we still have protections under the Equal Access Act of 1984? So again, the question is, how do you encourage young people who are invisible in a school setting to begin establishing GSAs without further traumatizing them? That's the first part of the question.
And what's that acronym stand for?
GSAs.
So it's the Gay Straight Alliance. Some schools call it like the gender, I forgot what that is, but alliance. But yeah, but essentially it's like the GSA. So I was gonna say, like, there is like the GSA network, which is a national resource for folks to think about, again, like if they are organizing inside of like their schools, like that can provide like the toolkits that can provide like the structure that could provide like the forms and information and the requests, right? And so I think it's thinking more so about like how do we build young advocates, like in people to advocate for themselves, right? So they have to feel comfortable enough like to do that, but then also letting them know like what being an advocate means and what they take on, right, inside of that. And if there are other kids inside of their schools that want to stand in support and solidarity with them, to have and create this club. I do know that, like, depending on where you are, it can be a little bit more tricky because some schools will say that, like, a GSA is like an extracurricular activity that isn't tied to a particular, like, academic program, right? And so it's thinking sometimes you do have to literally get creative of like who your advisor is. And so whether it's drama club or whether it's like English or whether it's history, right? Because we don't talk about queer history, but it's thinking about that, like you have to sometimes like help them navigate through like the school systems, because again, it's going to look different inside of different jurisdictions, and again, how progressive those school systems are if they actually allow like student clubs to be sort of kind of centered, and people that are against like anything LGBTQ inside of their schools or inside of your state, like you kind of like have to get them prepared for that journey also.
Anyone else? Like, how do you encourage young people who are invisible in a school setting to begin establishing them without further traumatizing them? Is there anything you wanted to add, Dr. Yu?
So I was thinking about the further traumatizing. So that piece is hard because there's no way of really knowing whether or not we can limit traumatization. But I think being able, if you're able to acknowledge a mentor or a faculty member in the school who would be willing to also serve as voice to administration. If there are other students who also want to help create this, the organization, the space, being okay with starting it outside of the school so that you can build momentum and support with each other before going to administration. Because if the core is already strong before it hits the school, then whatever administration may send their way, they may have the foundation necessary to provide research and statistics and to be able to support why this space is necessary to the survival of the population, or of the students, I should say.
And I think one thing that comes to my mind is the work that you, Elise, were doing last year with some of our local partners out Memphis, Rape Crisis Center, and some of those other agencies that were at the table, just to make sure that the teachers and administration of these schools, you know, committed to making space and creating opportunities to honor and acknowledge young people where they were in, you know, in their journey, right? You know, I find myself having to correct folks, you know, who knew that this child was male last year, and now this year this child identifies as girl or she, and and they still continue to misgender. Oh, okay, yeah, okay, right, okay, yeah. But again, you know, the intersection of, you know, that ageism where, you know, these children are seen and not heard, and you don't really honor young people because they're young. And then, you know, that then the whole homophobic piece or transphobic piece that is added to that, you know, I think that, you know, that those should just be normal professional development pieces that are just already embedded into the school system. I think the COVID-19 presents an opportunity for us to hopefully create opportunities for young people to have these safer spaces. You know, I know that that's something that we're exploring as we are in process of kind of revamping our Sister Reach Youth Ambassador program. You know, and especially if young people are not going to be able to go back to school physically. But you know, but I definitely want to caution, you know, principals and guidance counselors, teachers and behavioral health specialists for the shame and the blame and the trauma that is caused because you don't want to make space. You know, the playing field has changed as far as the mandate to make space. And you know, this isn't any different than any other situation. You got to make space for Spanish speaking children. You got to make space for gay kids. You know what
Absolutely.
I'm saying? You got to make space for young people who need to pray 3 times a day. You got to make space for gay people.
Yes.
You got to make space for children who have ability issues. You got to make space for gay kids. You know what I'm saying? And that's just the bottom line. We're too damn lazy,
Yeah.
as adults about the ways that we, we don't want to change. And especially when our young people are impacted. And it shows up in the way that we see legislation.
Absolutely. I think the assumption is that, even from parents with who have children who are same gender loving or LGBT in the LGBT plus community, I think the assumption is that, the teachers are already culturally aware, right? That the cultural humility is there. That's the assumption anyways. And so, but to walk into these spaces, and to hear the conversation, like you said, around a child who presented as male last year and now wants to be recognized as female, or who is transgender, to see the bias and discrimination that still exists, and it's matter of factly right in those spaces. Yeah, I mean, it was apparent even walking into a local school here that you would think that there was no training, that there was no conversation around orientation and sexuality and cultural humility. I mean, yeah, so absolutely, there has to be space has to be space made to accommodate every child, and not just what we were talking about earlier about even the medical providers, not just male and female, but every child, right? So yeah, absolutely. Anyone else want to chime in on that? I was just say, I see you writing, Latasha. I see you writing. It's all right.
I'm just writing my thoughts. There's so much great information among the panelists.
Absolutely. And so here, I want to stop to thank you all for your time tonight, for your expertise, for your wisdom. And I know we only scraped the top, because there was so much substance and information that was given. I really appreciate your time. And so in closing, for those who are watching, can you give, name and contact information for your organization for those who would like to reach out with questions about your services, or even about something that we may have covered that those who are watching may have heard you say, and they want more information about it, and just in any particular order?
I'll start. Latasha D. Mays, New Voices for Reproductive Justice. You can follow us on Twitter and Instagram at New Voices, the number 4 RJ. If you're in Philly, Cleveland, or Pittsburgh, we have respective city pages on Facebook. Our website is newvoicesrj.org. Our phone number at our headquarters is 412-363-4500 or 412-450-0290. And our general email is info@newvoicespittsburgh.org. But it'll be changing soon to match all of our other communications. So thank you for having me tonight. It's my honor to present with such a distinguished panel. We love Sister Reach. Thank you for your leadership on reproductive justice nationally and in Tennessee. And we love that we get to lead in this movement with you.
Awesome, thank you.
I can go. So Deshawn Usher, you can find Mobi at mobi-nyc.com. If you want to watch any of the talks, they're available on YouTube. It's easy if you just type in either Mobi Talks or Mobi NYC, and it'll pull up. I promise you, it'll be some of the best 30-minute segments of your life of just seeing culture and community and the visual aspect of it. We are also on Instagram, Twitter, Facebook. Just type in Mobi NYC and you'll be able to find us. And then for GLAAD, it's similar. It's GLLAAD. oh, sorry, no, it's not GLLL. It's GLAAD.org. And also it's GLAAD on all platforms. So GLAAD. And I'm glad really focuses again on media. And so it's also thinking that like if there's anything that like you deal with on the local level, particularly like if there are like stories that you do want to elevate and amplify, just know that like you have a national organization that stands in support of making sure that reporters and newsrooms and radio folks and all forms of media are held accountable. And so we would love to like continue getting stories and sharing that out into the world to make sure that we're telling fair and accurate stories for people to understand.
Awesome, thank you.
I'll go next. Yumika Hankton. I'm on Facebook and Instagram. Instagram, it is UNH_PhD. On Facebook, it is Dr. Yumika N. Hankton. Our email address is unhcounselingservices, plural, @gmail.com. And the telephone number is 901-300-9082. And just a little FYI, tomorrow begins Minority Mental Health Awareness Month. So I'm putting in some work to provide some psychoeducation. So just check in with me by Saturday for updates on the social media platforms. And once again, thank you for this opportunity to be in this space with you all.
Thank you.
And I'm sure, at least, that you're going to talk even more about how folks can reach Sister Reach. But if you want to reach us, definitely email contact@sisterreach.org. You can find us online, sisterreach.org. We're on Twitter, we're on Facebook, we're on YouTube, we're on Instagram. Sister Reach. Tomorrow I go on my first day of vacation because it's my birthday month as of tomorrow. Yay, 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 yay for the vacation. And so it's very specifically around our LGBT work is Elise. Elise is our lead on that work for the Boy Talk program. And we've also had folks to reach out who don't identify as masculine of center. Like, we've had friends and folks say, so what's up for the lesbians? What we gonna do for the femmes? And so we definitely want to create space, and make opportunities to continue to expand the work that we do. We recognize that, we live in a city that is still quite marginalized around the needs of Black queer people, which is why we have created Boy Talk, and we continue to want to do that work. Sometimes some of that, in reproductive justice, we're really intentional on making sure that the population that is most impacted reflects the leadership of that population. And so, we invite you to volunteer in that way, to come and to hang out with us and, and help to build a program like that. Because it's something that, at the organization, not everybody can hold, and I don't always have the capacity to hold. And so definitely want to invite you to do that. And our offices are still physically closed because of the quarantine. Stay at home, Memphis.
Please.
Stay at home.
Say it again.
You know what I mean? Because we're dying at the highest rate.
Yeah.
And though our governor can come down here and stunt and do pictures, we're not being taken care of, and Black folks are dying at a disproportionate rate. So I'm going to encourage you to stay home as much as you can. But Boy Talk is online. Reach out to Elise, and I'm sure that she is happy to, like I said, expand our programming to include all folks. And thanks so much for watching. And Elise, thanks so much for holding this space so great, so beautifully. I appreciate your leadership, and I appreciate being able to go on vacation because I got a dope deputy director. Hallelujah!
The boss is away, the children will play.
And now, oh God. Okay, well, at least we at home, okay? So thank y'all.
Yeah, and so for those to end, thank you, Sharice. And for those who want to, who desire to learn about what Boy Talk is about, you can reach out to us at contact us at sisterreach.org for any questions that you may have. For those who are masculine of center, gender nonconforming, and transgender men, we have conversations in a safe, confidential space about sexual health, reproductive health, relationships, career. We have these conversations because there aren't many going on for us in this space. And so again, feel free to join us at www.facebook.com/groups/Boy Talk, right? All right, and so again, thank you all panelists for your time and your participation. I appreciate all of your expertise and wisdom you've lended us tonight. And so if there be nothing else, if all minds are clear, thank you so much and good night.
Thank y'all. Thanks, Latasha. Thanks, Deshawn. Thanks, Dr. Yu.
Yeah,
Y'all the bomb. Thank you.
My pleasure. Bye, y'all.
Good night.
Bye.